Welcome back, everybody. You guys have been a great audience. Thank you so much. I know many of you are coming up with some great feedback, already starting to think about next year. So we will be sending out a survey to get some feedback, but also before you leave today, make sure to tell myself, Balaji, any of us that you've seen sort of facilitating. The more feedback, the better this gets. So without further ado, our afternoon session, our afternoon is a little different than our morning, so we will be talking about the business of innovation. So we've got a fantastic panel of folks, and I would say compared to our morning where we were focused on healthcare industry, I think the business world has done sort of a better job of academia and industry and businesses partnering in really meaningful ways, especially in Cleveland. So I think I'm really excited to hear from all of you on how to turn opportunities into reality and what partnerships I think we've forged between academia, Metro Health, University Health, and what some strategies are. And then, of course, we've got Rich Mazzola, who is the co-founder at Project MedTech and a partner at a 72-Bit Ventures. He provides startup and finance consulting services to early stage and scaling companies. His focus is to remove the barriers most founders face from product launch to exit. As a startup finance consultant, Rich works with companies of all sizes to assist in strategic pivots during periods of accelerated growth and investment. These are really good buzzwords. I like it. Prior to launching Project MedTech and 72-Bit Ventures, Rich worked as a director of finance for a technology SaaS startup and startup consultant in several CPA firms. And he spent much of his time focused on accelerating growth in operations and finance. Rich also dedicated much of his time to strengthening relationships with investors, strategic partners, and banks. Rich graduated from John Carroll University, so he is an alum. So we'll with a bachelor's in accounting with his experience working within CPA firms and startups. He understands the intrinsic value in business and assists clients in maximizing their exit. So without further ado, I will turn it over to Rich. We're really lucky to have you. Thank you.
Well, thank you, everybody. Great to be back at John Carroll. And today we're joined with David, Sylvan, Julie, and Elad. Thank you for joining us today. I'd like to start, we'll start with David and work our way down, but who you are, how you got into healthcare, how you got into innovation, and more or less, where do you see innovation at today?
Well, first of all, good afternoon, everyone. John Carroll, thanks for hosting us. Agility, thanks for hosting us. And Melissa Cole, School of Nursing, tremendous to see what you're building. I'm David Sylvan with University Hospitals. Germane to today's topic, I'll be representing the Ventures platform, the Ventures and Innovation platform. I also have a systems strategy responsibility as well. Rich, I got into healthcare by mistake. I was a frequent flyer from the perspective of being a patient, not very patient, and about 8.5 years ago, was asked to consider a 6-month consulting arrangement with UH. I had no healthcare background. I come from investment banking and capital markets and professional sports, the business of sports. And 6 months came and went, and I fell in love with mission, with the perpetual, unfinished business of what it is that we're here to do, which is to take care of our communities, our populations, and our patients. Innovation is not new to healthcare. All of our systems, the ones represented here today, others that we've heard from earlier, have only survived because of innovation. It's almost anathema that you would need an innovation department for a system that has survived for 150, 160 years. But we really determined that there was a need for some centralized enablement and resourcing in order to improve the velocity and the quality and the pace of innovation. And that's the intersection that we sit at today.
What he said. Hi, everyone. Thanks for having me. Julie Giacono. I'm the Chief Strategy and Innovation Officer at the Metro Health System. So how I got into healthcare, I was an engineering student at Case Western, and I had a scholarship for aerospace engineering, and I found it very dull. And so they had a biomedical engineering program, and I thought innovating or designing things for people's bodies and for people is a lot more interesting than airplanes. Though the Vomit Comet, which is something at NASA, was interesting, but other than that, it really wasn't. So I switched, and they allowed me to continue to keep my scholarship because at that point there weren't a lot of women going into engineering. And so then I spent a lot of time in the for-profit. I did engineering and business and went out and did product development for lots of medical device type companies. And I was traveling like 60%, and I had a couple of kids and didn't want to live on a plane, so I figured what could I do that still used my skills. Like David, I approached Metro Health, or they approached me, I can't remember, and said, I'm just gonna do something on the side to help you do some business cases because I have some skills. And that was 12 years ago and 9 jobs ago. So what's interesting, I think, in a lot of these areas is there's innate innovation in healthcare, right? How do I save a patient? I think what we're talking about here today is intentional innovation, things that you're really putting infrastructure to have a process that's not just by chance, but it is absolutely imperative to your strategy. I don't think there's any, it's not lost on anybody that both David and I have combined strategy and innovation, because if you are in the hospital business today, if you don't find a way to innovate, you're not going to survive.
I'm going to pick up on that. My name is Alad. I serve as the Dean of the Boulder College of Business here at John Carroll University. Always nice to have alums back on campus, and such a fine example of alumni that we produce here at the university. We are very much a partner in this event today, and I'll take you through the evolution based on Rich's question. My background is in venture capital investing. To me, innovation is, and I think broadly, innovation is the engine of any economy. An economy that doesn't innovate will be stale, will eventually grind to a halt and fail. And so innovation is something that is systemic to survive. And I come from that type of background. There is now, and has been for the last couple decades, a significant growth of technology integration into medicine and healthcare, as we heard this morning, and as we heard throughout the whole day. And so a lot of applications that don't necessarily start as medical or health related get modified towards a health purpose. And I happened, among the many companies that I invested in and worked alongside, and just so we get this clear, in venture capital, you're successful if 8 or 7% of the companies you invest in are actually successful. So most of the time I fail. My president here will attest to that. And so we look at what's succeeded, and I was lucky. I think we need to talk about luck at some point. I was lucky to be at the right place at the right time with a bunch of founders who came from the aerospace industry, specializing in cameras, and thought to themselves, wouldn't it be cool if we could miniaturize a camera to be so small that a person could swallow it and it would go through their system, and hence the pill count. And so I was at the right time, at the right place with those founders to move that along all the way to an extremely successful exit. And of course, that's the exception, but that's how I got into healthcare. A lot of lifetimes and jobs later, I got into higher education with the mission of preparing talent into this ecosystem that is so important to all of us. And being in Cleveland, how can you not interface with healthcare, right? And it is the #1 vertical. And so that is the long version of how I got into healthcare. Now, being a dean of a business school in Cleveland, of course, we will connect with leaders like Melissa, who are running the nursing and now the School of Health initiatives. because that's the ecosystem that we're in.
Yep. And I think a lot of this is driven off of ecosystem development, starting foundationally with healthcare. And so I want to define what innovation is. So for Metro, for UH, what is innovation for you and your organizations? How do you approach innovation? Is it a tangible object? Is it a operation efficiency? How do you view that? How do you incentivize that within both of your hospital systems?
So I would say that we have layers of an onion. We want to have a culture of innovation because healthcare in many industries, but healthcare in particular right now is very hard. There's not enough people. The people that are there are burned out. The patients are hard. The whole system is sort of very, very difficult. We also have an incredibly terrible product, right? So healthcare is something that people need. It's not like you wake up in the morning and say, boy, that healthcare experience was just top notch. So you have all of these things. So you want to have a culture of innovation so that everyone believes they have the ability to make improvements. I'm going to call that incremental innovation, process improvement, whatever you want to have in that. But you have to have 100% of your organization working towards making these tiny little improvements. Then there's, I think, what the traditional definition of innovation is, which is you're going to create something, know-how, a copyright, a patent, something that's inside-out innovation. We're an academic, part of, an academic medical center. People who come there want to be part of things. There's lots of NIH research. We do very little of that. UH clinic case has a lot more of that. We do very little. Where we do a lot of our emerging innovation is outside companies that want to co-develop. They've taken something to a point where they think they have an interesting idea, but they don't have a first customer. It's not actually done and ready for sales, and they don't know how to approach us because a lot of times they're either tech or they're money. They're not healthcare people. And healthcare is a Rube Goldberg machine. You cannot figure out exactly how to get your product to market. You don't know who uses it. You don't know who buys it. You don't know anything. It's intentionally complicated system. And so outside in, innovation is us really co-developing with a company. And in that, we are then contributing some last 10%. And many times are also their customer in the end. So in those types of areas, whether it's outside in or inside out innovation, we have formal programs because you can imagine you don't want 1,200 physicians to just be able to sign contracts with companies. That would sort of be chaos. So you want to have sort of a way in which that happens. But I'd say that at the start, you have to have belief that everyone is part of an innovation culture and that how we've always done it can't be what we accept today.
And just a quick question as a follow-up. I mean, who in your organization does innovation? I mean, is it anywhere from the nursing staff all the way up? I know that's been a big motto from Retro.
So I would say the culture of innovation has to be everybody, right? When it's outside in, we only engage with companies that we experience operational pain. So if we're experiencing operational pain, then we'll go out and look for a company that is working in a particular space or companies and say, listen, we have this problem. You might have part of the solution. Let's finish it together. But in that regard, it's really that, I would say those types of innovations are at a strategy level. We can look out and we can see, the light that's coming isn't a good light, it's a train, and it's gonna hit us and we have to find a solution. And we might as well figure out a way to co-develop our way to that solution.
David?
Everything that Julie said resonates, proof that there's not much that's new under the sun. The element that we bring to the table, Julie did allude to, and that is we're a very large research institution. And so it's incumbent upon us to give some threshold of life, longevity, scalability to the intellectual property that our researchers, our clinicians, our bedside staff, our environmental service workers, our administrators are able to conjure. They live at the coalface of the problem. And so the best solutions that we're able to source actually come from the people who are invariably attempting to MacGyver their way towards that endpoint. We look to put structure, mechanism, and resourcing around that. We too start with a problem statement-driven thesis. We detest solutions. We really send solutions back to the drawing board and ask for a well-articulated problem, because that helps us tease out root cause, helps us tease out how we might then be able to lean in, either by attracting through a call to arms, if you will, a company from the outside who might have a partially, fully, or adjacently baked solution to the problem, or enter into a similar co-dev type arrangement. And we have some of our co-dev leaders here in the room with us today. Culture is critical, and I think for us, part of that is the permissioning of democratized innovation to ensure that it isn't solutions innovation coming from leadership, but can be sourced from anywhere within the system. And some of the finest activities that we've come across came from the least likely places.
I think it's unfair that he has an accent. I just
So does he.
A really good accent.
Right. I mean, everything he says sounds better, doesn't it?
All the time.
I know, it sucks.
You automatically pay attention.
I am just like
He gave
so
me a
drawn
grocery list,
in.
and
Like,
I was like,
that's so
whatever you
lovely.
want.
It sounds so smart what he said.
Funny. So I want to, David, I want to touch on.
It's a feature.
It is. The UH Ventures team a bit too as well. So we'll get into different types of innovation with organizations and how they invest in what and where and what investment means from a resource perspective. But one of the things I thought was the most interesting with the UH Ventures team is you guys have an acronym called SPICY. Can you define that? I know Kip came up with it, but what is SPICY?
You know, we all suffer from shiny object syndrome. We see 400, 500, 600 opportunities a year from the outside in, let alone the couple of hundred of innovation or invention disclosures that we solicit from the inside. It would be very easy for us to want to become sufficiently enamored with all of them, and we'd be too deluded. It would be impractical for us to think that we could pursue all of these opportunities. So the first lens of adjudication is, does the opportunity map back against a strategic imperative? And in order for that to be given life, there also has to be an internal champion or champions who are in a position to want to take on the incremental responsibility. Everyone has a day job. Most people have more than one day job. But take on the incremental responsibility to lean into giving that opportunity its clinical affirmation, or embarking upon a co-development type arrangement. Candidly, we can be selfish. It's got to be interesting. It's got to be, the threshold of excitement has to be there to want to motivate, behaviorally nudge people to want to engage. We're indifferent from the perspective of whether it's a point of care tool or whether it's systemic and a solution that would impact the business of healthcare, supply chain, rev cycle, et cetera. But it's really that spice, that filtering mechanism really enables us to gently let people know that the baby might be ugly, but perhaps suggest manners in which they might be able to use either prosthetics or makeup to improve the appearance that we might be in a position to reconsider, or candidly just say no because we'd be stretched too thin.
Yeah. So is it spicy enough?
That's right.
Yep. So Alad, I wanted to tie this in because I think this is an exciting. When I was here, the entrepreneurship program maybe is not as robust as it is today. So the new nursing program, the robustness of the entrepreneurship program, how do you view early education within this university with entrepreneurship and nursing to combine to influence future healthcare within either this ecosystem or the greater ecosystem?
Yeah, the idea with ecosystems is you got to have a pipeline of talent. None of this will be possible for these two health systems or any system to encourage and engender innovation without talent coming through. And that is one of the many missions that we take on. And so being an institution of higher education with a Jesuit tradition of doing well onto others, fits into this ecosystem and what we're trying to do, and that is develop talent into it. And by the way, retain it here in Cleveland. As you know, it's not something that happens as often as we would like, right? And so there are two elements to, at least, to innovation within higher education. One is internally, us as an organization innovating. I would say gently that there are a lot of similarities with health systems in that way on the administration side. On the content side, you know, the philosophy that we have here is developing students that will, as Al says, surprise the future. And if you're going to surprise the future, you really need to be able to be encouraged to take risks and to go beyond where you are as a young professional, as a young person going into your life and your career. And I'm glad that there are philosophy students here, because we encourage students from all over campus to engage in our entrepreneurship program, because the diversity of opinions and viewpoints is critical. Creativity comes from diversity. And so that's something that we are supporting and encouraging our students to be involved in, whether they're business majors or not. Even philosophy majors and finance majors are sitting here now and sort of interacting with that type of thing. Melissa and I are working in, you should be mic'd up, Melissa. Melissa and I are working on innovating, right? So she's an innovator within higher ed, creating new programs under a vision of innovation. And within her program, there's an innovative component. And so we're looking at the business of health as something that we want to launch down the road, a variety of opportunities for nurses and physicians to get their graduate degrees and things like that, because, and I know you're one of the very few people who follow me on LinkedIn, so you saw when I posted that most unicorns, their founders did get a higher education, and there's a broader discussion, public discussion about the value of a higher education. And again, you follow me, so you see that I'm very much on the side of it's worth it.
Yeah.
And not only is it worth it, when you look at the bottom line, when you look at what it produces, it's undeniable. The value is undeniable for the economy, for society, and for individuals and their families and their communities.
Yeah. Now, go
I
ahead.
just want to add, I think that as we're talking about this, whether it's in your school or in a health system or in a company, innovation is something that is super exciting and sexy, but it's also super risky and dangerous. And so we think about, and I think you do it as well, David, is there's parts of your operation that you exploit the hell out of, right? And that has to be just doing the same thing over and over and over again, looking for efficiencies. That group of people or that part of the organization cannot get distracted by exploration and innovation. So we segment innovation into an exploration area over here where we know it can get messy and it takes long and there's risk to it, and you don't want to, endanger the whole. And so one of the things you have to think about as you're talking about just innovation in general in all of your, and I'm thinking about this as you're talking about their school careers. There's classes, I'm sure you don't want them to take a risk on everything, right, all 4 years, but there's parts.
Not the accounting.
Yeah. I mean, because if I hire people, I want to know that they know how to run a spreadsheet. I want to know that they understand their numbers. I want to understand the basic principles of your degree, but I also want you to have a little bit of that, exploration on the side where when, even a founder, if you were just exploring the whole time, you're probably not going to be able to run a company, right? You have to sort of be able to know when you can do both.
The flexibility. And so when we talk about philosophy majors being in the room, I think it's important because you both said anybody in the organization, it's a culture of innovation. And so a lot of the times in the startup world, we talk about problem then solution. So people tend to fall in love with solutions first, not the problem. And the best founders are the ones that intrinsically know the problem itself, right? And so within a hospital system, a nurse who's having an issue on a floor, a pain point, will know the best way to solve that, potentially, or at least brainstorm around it. And so from that perspective, training people early on in both career and whatever their degree is, but then also adding that flavor of entrepreneurship to it to understand when there's weaknesses in what we're doing today and evolving that platform.
There is one more thing, Rich, that sort of between the lines of everything we're saying here. Failure is something that needs to be embraced, encouraged, because you can't build a track record without failing, and learn from it. And so going back to the keynote this morning about if you come from love and you assume positive intent and you're trying to innovate and improve and push forward, you're inevitably going to fail a lot. Like I said, a lot more than you'll succeed. That cannot be a point of shame. It needs to be a point of inspiration.
Yeah, 95% of startups fail, I think is the metric out there, somewhere around there. And it's the idea of even if you fail 95% of the time and you save one patient's life with your idea, that one idea that worked, isn't it worth it? Right? And it's all about just that constant repetition. You get better.
You can't get to the 5% without the 95%.
Correct. And you keep getting better every time you innovate and every time you change and adapt. So let's talk about investing in innovation, right? So we talk about startups forming companies. There's different ways to do it. So there's investing outside, right? So inside out is where we're taking money from institutions and investing in companies that are external to the organization we're working for. There is investing internally, where there is an idea cultivated internally, created internally, and implemented internally. And then there's the idea of inside out, where an idea came out of an institution, whether it's education or a hospital, and a company was formed around that. And so I'd like to just touch on each of your organizations. What do you get involved in out of those three kind of buckets? What do you do more of? And what's the most advantageous for a university, for a hospital system?
I think you have to take a balanced portfolio approach to that, Rich, which is obviously something that's near and dear to your heart professionally. To avoid concentration risk, you have to be very mindful of how you are orchestrating your sourcing. Certainly to the extent that we are able to nurture our homegrown cooking, we place a lot of reliance around that. But we also realize that the submitters of those wonderful ideas are invariably not people who are innately trained to then be able to put the opportunity in a position to scale, grow, and perhaps take commercial flight. We have colleagues in the room who run one of our accelerator programs, for example. We've orchestrated a mechanism by which we can plug these opportunities into a curated pathway towards potentially assessing whether there's going to be commercial viability. We use our own balance sheet for that. We use non-dilutive sourcing from various state mechanisms, federal mechanisms, all with the hope of de-risking the opportunity to a point where by the time we write our first check, it's sufficiently de-risked. It doesn't mean it's going to be one of the 5%. Maybe it has a slightly higher bogey towards success versus something that was coming out cold. But we also suffer from a fair degree of myopia in healthcare. We tend to believe we can solve for the majority of our own problems. We repeatedly prove that we cannot do that. And so it's important for us to look outside of healthcare and outside of traditional sourcing when it comes to potential investment opportunities to match up against well-defined problem statements. Other industries have already solved for many of the things that still vex us. Why should we not be looking to industry to perhaps look at a prepackaged solution and adjust it for our own needs and our own use case? Speed to realization of value would be far quicker if we were more receptive to that. So we spend an equal amount of time investing in companies that we source from the outside. Some of those are introduced to us by Elad. Some have been introduced by you. We're looking at an opportunity together with Metro Health as we speak. So we're comfortable in being agnostic from a sourcing perspective. It also doesn't have to be domestic. We're working with companies out of the UK, Brazil, Israel, Singapore as we speak.
That's great. And just an example of that, right? We have in our pockets cameras that are microscopic now that now can fit in laparoscopic 5mm cameras for surgery, right? Taking innovation that came out of a cell phone and now packaging it into a medical technology that makes patient care better. So, Julie?
I think it's a little bit more tricky. We're a governmental public entity. And so lots of rules, right, around taking public dollars and investing them into for-profit ventures. So we have to be, have a very different sort of lens. We also, you fundamentally need a surplus of cash in order to make lots of investments, and we take care of part of the market that is not typically awash in cash. So we have to be very creative in how we invest. We invest a lot with contribution, abatement of services. We contribute, whether it's clinical or operational enterprise to a company. I was thinking, though, you were talking about the failure rate. I think we've created 4 companies. If all 4 of them don't work, I'll be fired. So I think when you look at a hospital investing, you have to be very certain the hospital's money is going to go into something that can work. We tend to be first money in, we're not big money. But it has to be that something that has a high likelihood of working.
Yeah, speaking of first money and big money and a variety of levels, really, in funding and in funding innovation in particular, when you graduated, you probably had very little of the knowledge you have now relevant to what you're doing now. And that's a gap that we're aiming to close, because we know that there's more and more demand for the skills that you developed after you graduated for our graduates as they come out. In fact, we insist on that. There's a variety of things that we do at the university and at the college that focus on providing students with that. And the 3 that I'll mention are, we put a strong emphasis on technology in a business school, because business is technology. And so it's more about being technologically proficient and understanding emerging technologies and how they integrate or could integrate into business applications. We put a strong emphasis on learning by doing and having our students get their hands dirty and make as many mistakes as they can here before they go out and it matters and they might get fired for it. We're not going to fire anyone, right, Al, for making mistakes as students? Yeah.
We can be.
Yeah, and so so that is incredibly important. And so when you combine that, you can and those motivations, you can see why we launched a student managed venture capital fund. That's, I'm sure you wish you had when you were here. Blue Streak Ventures, in case you're wondering. And the idea there is to let students learn venture capital, understand how to fund innovation, and work with alumni and student companies that come from the entrepreneurship space, which is robust here, and really have an ecosystem within this college and university that mirrors the outside. And so when our students, and that's the 3rd element that I wanted to mention, when they interact with employers, because we mandate at least 1 internship before they graduate. And so very soon here we're going to have a career night, and our freshmen are going to be attending that. Of course, the rest of the classes as well. But think about it, a month ago they were high schoolers, and now they're already interacting with potential employers. And as you know, there's a huge employment crunch in the market, and so we know that we're giving them an advantage. And we're doing all of that, but also with a bottom line view, right? At the end of the day, we also raise money. He can't fire me because I'm tenured, but still, all joking aside, I raise money. He wants to see that.
We should bring tenure into.
And he wants to see a return, and so do I, right? And so do our donors, who are now in effect LPs, which is exciting for them. And so that's innovation on its own. The actual process of building an innovative academic educational system in an institution of higher education is innovative.
And just to touch on Blue Streak Ventures, if you haven't looked into it, it's a great opportunity. We actually, one of our femtech companies already pitched the group, which is
Excellent.
Fantastic. And so just to highlight some of the aspects of that, there's a back-end office that will provide the organizational support beyond just capital. And so that's a huge
Studio model,
a venture studio model, if you want to look it up. But yeah, no, very, very unique and very cool opportunity coming out of a university. So a lot back to you for just a quick second. So based on their responses of how they invest, where they invest, how does that adjust your thinking or reinforce how you're educating today in both entrepreneurship and nursing?
What's important, and you and I spoke about this before we started the panel, What's important is to have a literacy in terms of the marketplace. When you look at the grand movements in the marketplace over the last couple of years, there's been a significant shift. Founders now need to be a lot more pragmatic, a lot more convincing. They can't come with 3 slides and flashy gizmo and say, give me money. They used to be able to do that up until a few years ago, part of the problem. And so now they actually need to understand numbers. They need to understand how to build a team. They need to understand how to work with a variety of funding sources. But the market is tighter now. And as I shared with you privately, that's a good thing. It's a good thing because it's more disciplined, and it's a good thing because the competition that isn't up to par will be washed out of the market, and that's always a positive. That's always a positive development. It does mean, though, that founders and their teams need to be a lot more rigorous in their approach to both fundraising and building the business, and at the end of the day, hitting the bottom lines, hitting the numbers, as you and I were talking.
Right. And so when we talk about startups as well, pre-seed information technology is coming out of an institution. Seed, we're developing it further. We're trying to get clinical efficacy. Series A, we're commercializing, scaling. Series B, growth mode, right? Rocket ship mode. When we talk about what you just touched on, which is we need to know more earlier, the questions being asked at the pre-seed and seed level were not asked when I got into this. It was there, that was all around the Series A level. And so now we're starting to get more questions early because they want to see the full plan spread out across the entire life cycle of the business. So question to David and Julie, when you start thinking about inside out, where is that launch point? Where's that, we're thinking about it, we're testing it, oh no, this is real, let's go. When's that moment for you guys internally?
We do run all of the traditional traps when it comes to assessing viability. We think about the magnitude of the unmet need. We think about the potential size of the addressable market. We think about what type of funding pathways would need to be secured in order to get to product market fit and scale. But the one thing we can't invariably solve for when it comes to inside out is that talent quotient, is the identification of the jockeys, if you will, who'll be able to take the opportunity out of the academic setting and the safe confines of willingness to experiment and fail, and put it into the rigor of the real world, which is very unforgiving and very quick to provide appropriate feedback, if you will. So we lean on arm's length and outside set of lenses to help us make sure that we're not too close to the opportunity from an excitement perspective to prejudge success, and really give us that sense that from the outside in, this opportunity that we're looking to spawn actually has some viability. There have been things we've been very excited about. Our advisors have said this is the bridge to nowhere, and so we've been forced to either force a pivot or a revert or sunset. So we tend to want to place reliance on the experts from the outside. You know, Kendra's here. She manages one of our platforms, a technology venture and startup fund. We're actually not permissioned to make decisions, go forward decisions on our own technologies. We have to use third parties to give us that arm's length opinion. So it's really a function of when does gut and intuition meet with fact and empirical evidence to signal that we're at that sort of inflection point.
I think the arm's length is a very key thing. I want to just add in one other thing, which is a little bit off topic, because I was intrigued by that comment earlier between nursing and the whole entrepreneurship. My husband is one of his doctors and in the ICU. And when I talk about innovation at home, he says, I hear death. I hear death. I get to work on slides and spreadsheets. If I have a bad day, no one dies and sues me, right? And so when we talk about nurses or people who are in a position to deliver care, we have to think about and have a deep respect for innovation and how they innovate. Most of the technologies, and the reason that I think the money is dried up in some cases around health tech is these disruptive technologies have hit the reality of healthcare, and they're too disruptive, and there's too much risk. And so how do you really sort of come to grips with that? How do you find those clinicians who, in one part, we demand of them, follow the protocol, stick to the plan, don't question. This is how we save lives. This is proven, evidence-based. But over here, we're asking them, be creative and innovate, right? I mean, let's think about what we're asking people to do and what license we give them to do when, right? There's times where you want someone to have heads down and not question, and there's times when they have the latitude to do so. For the students in the room, one of the things that I really want you, if you take nothing away from my comments today but this, if you're looking to be an entrepreneur in any industry, understand how that industry works, from the macro forces to the micro forces. Because you might think you have a solution, and if you don't have a good understanding of how all of that fits together, your solution might suck, right? Because it doesn't fit into how the ecosystem actually works. We get pitched all kinds of things that that's not actually a real problem. You might think it's a real problem, but it's not. So know your ecosystem, and then know who when you're going in to talk to that, we would love innovation from our bedside clinicians in very, very specific ways and times. Otherwise, I really don't want. I want them to focus on what we as an institution have said is evidence-based. And that's a really interesting sort of thought, is there's a time and a place for innovation too.
Completely agree. I guess anything.
Yeah, I have to agree, and we need to build our innovation mechanisms that way, right? Platforms for innovating.
Yeah.
Some of the medical innovations that I've been involved in and invested in, and some of them actually succeeded, came from a specific moment, maybe even a second, where a physician or a nurse said, "Oh, I wish I had a thingamajig that would do this right now." Most of the time, these ideas would float into space until health systems said, no, we got to have people like the two of you sort of capture that, right? And so that's the type of creative process that, and when it comes up organically, right, you don't want them floating up there 99% of the time. But when it comes up organically, if you miss it, you probably can miss something that would be quite influential on future developments. That is something that we have the luxury of doing, that we actually encourage, right? Constantly be in that state of innovation, surprise the future, think about what exists. But I do want to double down on the advice you gave, because I think it's critically important. Sometimes when we talk to students, or when I talk to entrepreneurs in general, and they think about disruption, right? And it's like, it doesn't just come out of nowhere. You're not disrupting in a vacuum. What you're disrupting, by the very nature of the word, is something that already exists.
Right.
Learn what exists
first. Yes.
Yep. So we're going to pivot to questions from the audience.
Yeah, thank you. And I'm going to talk a little bit about that in my fireside chat with Balaji. So, Julie, that's an excellent question. And I think from a nurse perspective or a clinician perspective, it's about problem solving and where and when that's appropriate, right, to think outside the box. So we'll talk more about workarounds in a little bit. But I'm going to kick it off. And then for those of you who weren't here this morning, this is an unconference. So we want the participants from the audience to engage either questions back to them, or they can ask questions to the audience. So I'm going to kick it off. We sent out a survey, and one of the questions that was asked was, how do we ensure that medical innovation benefits all and not just the wealthy? And how does it take differences in gender and race into consideration?
Oh, an easy one. Yeah. Why don't you start?
So, there is an element of, this is where I do believe the invisible hand of the market works in some regards, or is starting to work. In this country, more than half of the healthcare consumers are women. More than 45% are on Medicaid. We have so when you take a look at who your market is that as a product that you might be going after, you really have to take into consideration a lot of these things. And then you have regulation, which is now saying to health systems, you have to report on your outcomes based on gender and race and ethnicity. You have to be able to measure and identify social barriers of health and what you're doing about it. Having said that, if the market doesn't demand something different will not be developed, right? And so as we were sort of moving towards outcome-based healthcare or value-based healthcare, we were becoming incentivized to do the right thing, not to do things that we get paid for, right? To do the thing that actually resulted in an outcome. Post-pandemic, the move to value-based has been slowed, right? Very slowed, and we're running back to, boy, it'd be great to do some fee-for-service procedural things, right? So that you got to look at that and say the market will only do we will only produce, products will only be produced for what the market actually demands. But in many cases, the market is demanding things that are for health equity for all races and ethnicities.
And while that's true, sorry, David, while that's true, if you look at the percentage of innovations that are geared towards women and minorities, they are a significant minority of the share of innovations. And so the market might demand, but if you actually look at the business dynamics, there's a severe imbalance. And I say that because if we're not deliberate in providing that type of innovation, we will embrace the current situation, which is insufficient. I'm proud to say that one of the companies that I invested in and connected UH Ventures with is specifically focused on women's health and taking AI and taking basically imagery that's used for detecting breast cancer and using that same imagery to detect the cardiovascular risk of a woman. And that, if you look at the numbers, by the way, they're staggering in terms of women that suffer from cardiovascular disease that goes undiagnosed. So imagine if they come in to do their mammograms and they get screened for that anyway. Imagine the impact for that. And that's something, like I said, going back to what I was just saying, you have to be deliberate about that. And I'm extremely proud to be in a position to be able to do that. Sorry.
You know what's really distressful is if you look at the evidence when it comes to, for example, woman-founded, woman-led businesses, their performance is disproportionately better than their male counterparts. And because Melissa said I could ask a question of the audience, what percentage of funding, VC funding, goes to woman-founded, woman-led companies? What percentage? Someone said 10? 1.7%. We're proud to say at UH Ventures that 50% of our portfolio is woman-founded, woman-led, or is a femtech-focused product set or solution. It's not because we went out and altruistically felt that we should lean into investing in woman-founded companies. It made bloody business sense. So why the market doesn't do it is quite beyond me. It does get back to intentionality. It does get back to purposefully focusing on the areas that are underserved, underdefined, underrefined. If we impose innovation on the marketplace, we'll create solutions that get the funding and only go to those who can afford. If we glean our insights, if the innovation demand is pooled via an ethnography and an insights gathering process, a design process, Balaji, that's where we'll make sure that we're obviating bias and we're creating and innovating and investing into the areas of unmet need.
Well, that's a great segue. Thank you for the setup, all of you. So from a market perspective, though, when consumers don't know what they don't know about their healthcare, there becomes an unusual juxtaposition to solve for there. And what I mean by that is a woman entering midlife at 20. I'm just kidding. I'm entering an unusual space in terms of female care. And so what that means for those of you that don't know, especially for the ladies in the audience, is that as you pass childbearing years, you don't really see your OB that often. Your primary care is not established to be able to provide you the care that someone else might be able to provide for you. And you enter into this unusual care gap, which leads to not detecting things at times. But where I'm going with this is when you think about innovation, I think philosophically the word, and why I'm so excited, David, for you to take on this chief strategy officer role with innovation attached to it, is, where I came from in the manufacturing world, you would do a lot of benchmarking, like who's doing what and how are we on par with how things need to be done. And healthcare is, I think, generally across the nation pretty behind the times, maybe a little bit, which we all know. But thinking about care coordination and getting ourselves there to the point that we know that we're fully wrapping our care teams around people at different points and ages and stages of life, I don't like that we call that innovation. So I think this overuse of the term is what I'm kind of throwing out there, and I'm not sure, we haven't really talked about that at work, but I think sometimes we're calling things innovative when it really should just be best practice.
Be evolution.
It should be the way we're doing it, but I would love to hear from you all in terms of how you're thinking about that, because I think it starts to tie into more strategy, right? Strategically, what do we need to do to get to value-based care? And these other things that we talk about so that we head them off before people get into the Medicare.
Are you going to share UH strategy? Because I'll take it.
I'm going to take.
He's not ready. He's been in the job a week, but I think it's just what I'm excited about in terms of, but I think throwing it back is, I think the overuse of the word innovation when what we're talking about is trying to get to a better state of doing things. And then there's innovation. So
I think one of the things I would say to this, though, is this is where I think we just have to be very careful not to be too Pollyanna here, right? There's lots of things that are the right thing to do that do not make business sense because of how healthcare is paid. Lots of things. So just because it's the right thing to do doesn't mean it's the right business to do now, right? And I think part of this is where you have to understand how the ecosystem works. How does money flow? Whose dollar is it? Well, I think this is where this is part of the ecosystem, right? Payers are very fragmented. We are not Canada, nor ever will be, right? A very fragmented system. The one thing I would say in this is, we think a lot about innovation, creating a company or investing in a company, but what is more likely to be true in healthcare? That the incumbents who take care of patients today should transform themselves, or that the US healthcare system is going to get reordered by startup companies? Wait, what's more likely to be true, right? And so when I think about innovation, there's part of it which is, how does the business of healthcare as a health system work? We gain market share, we get paid differently, right? All of these different factors. That's strategy, strategic innovation in your strategy. But it all comes down to, you still have to fit your product and strategy into how the money flows. And right now, the money flows in an asinine way, right? And so you have to do what you can and innovate how you can in that space. But when you come up and you can say, absolutely, what you just talked about, would love a company for that. I'm going to tell you, I think it's going to be a very hard sell. I'm going to fight like hell not to have my female patients go to someone else, right? So there's all of these factors that you have to understand. And should it be, what part of it is the incumbents transforming versus startup companies disrupting?
But you can't ignore market dynamics, which will impose its own will upon how we perform, regardless of our intentions. So an aging demographic, a shift to outpatient, a desire to be more tethered digitally, those are undeniables. And unless we can adjust our offering, regardless of the subset of the demographic, to those realities, it's self-fulfilling that we will fail at the task.
And I think what you deem as the overuse of the word innovation is partly because of systemic resistance to change being the norm. And as long as that's the norm, then you almost have to combat it with the label of innovation.
It's very innovative that you said that. It's an Unconference is very innovative, yeah.
Yeah, so similarly on that, concept of evolution versus innovation, John Carroll graduate longer ago than I like to admit these days, but really exciting to hear some of the specific gaps that John Carroll is approaching on technology and, just learning early on, exposure to employers, hands-on learning. I think that having that experience in an education setting is wonderful. I also think, tying back to something our table talked at lunch, I think it doesn't end at education level. So where I'd love to see is that continue on in the employer setting, because what we've talked about is how do you encourage employees to have that same entrepreneurial spirit, whether it's innovation, which to me can be a little daunting of a word. So if I'm day-to-day trying to think of ways to improve whatever it is I'm doing, innovation might seem like a bridge too far. But how do I make just a small step forward, or how do I know that that's encouraged, allowed, where to even go? And so we talked about, even just in a day-to-day, how can I as a leader encourage that with my own team? So I'd love to see that kind of continue on in the workforce, things that sounds like are starting here, in everyday life.
Yes, I agree.
I think, Melissa, part of an appropriate response to that is organizational permissioning of a safe space to be able to experiment. We have these wonderful idea submission programs at the hospital. As you know, we end up with tons of submissions, some very technical, some paint the hallway green, not so technical. The ones that have potential viability, well, now we've got a problem, because the individual, the submitter, doesn't necessarily have the time, capacity, or resourcing, because again, they have that day job, to be able to lean into giving that opportunity life. We're trying to create those safe spaces with accelerators and with some of the sandbox environments that we've built within certain domains, AI within radiology, for example. But those are discrete points. It's not yet systemic that experimentation, innovation, and failure is permissioned.
Okay, we've got time for one last question. Thank you, I feel honored. My name is Erica Kennedy, and I'm the Director of Sponsored Programs at John Carroll. Here, I've been at large academic medical centers, very high in research activity. So my question around innovation is, recently, I think in spring, May-ish, there are some new government entities that have been developed under HHS, ARPA-H, some others that are, I can't think of all the acronyms right now. And when I read the calls for funding applications, they're forcing innovation, right? They're telling, and they're deciding right then and there, this is what we want you to innovate around. This is how we want you to do it. It's very interesting, and I'm wondering if you've seen this, had teams go after these, and what is this going to do with a new arm of the government telling us how we're supposed to innovate and really putting unlimited money behind it in the calls so far?
So yes, we've participated in a number of submissions. Some we've done in collaboration with other systems in order to create enough sort of critical mass from a regional perspective to attract the funding. Here's the good news. Someone once said to me at UH, close your eyes, spin around, throw a dart, whatever you hit is broken. So the notion that innovation is being imposed upon us in this scenario is not necessarily bad, because invariably it's going to be relatively close to something that does need to be fixed. There is some latitude in the manner in which you go about or embark upon leaning into conforming with the rules and regs of those apps. From my perspective, and maybe this is just because I'm a realist, better to have some threshold of innovation imposed upon us with funding, which is our scarcest resource, versus attempting to do it with non-existent balance sheet.
And I actually think I'm very supportive of it. I think there's a recipe to innovate. There's a whole bunch of individual PI-sponsored research ideas where people can go in and come up with their own way, and their peers figure out whether it's good science or not. This is problem solving. I've got a problem. I want you to solve it in a repeatable, rigorous fashion, and I want to know you did it, or you don't get the money. Like, to me, that's what your life is going to be. So, that's sort of like I'm supportive of it.
Yeah, I like it as well. I think, first of all, it goes back to what we were saying before. In order to disrupt, you actually need to know what needs to be disrupted. And so I think that serves that purpose. But for most of my career, I invested in companies that had a very clear idea of what they were trying to innovate. And so I think it was said here before, fall in love with the problem. Basically, the functions and the people with the money here are telling you what their problem is. And I'm a big fan of that.
All right, so David, Julie, Lod, thank you for joining us. Any closing remarks, any passing words of advice to the audience before we disconnect here?
From me, I would just echo a lot of what's been said to the students. Don't feel that you need to choose a lane line for the duration of your studies. Experiment outside of those lines, because all knowledge is accretive. And I think the general umbrella of entrepreneurism is a wonderful way to be multidisciplinary and cross-disciplinary.
I think what I'd add to that is you don't have to go all in. You can be a economy risk person and decide 10 years from now that you're going to solve a problem and do a stretch assignment and innovate a little bit on the side. You don't have to put your entire, how am I going to pay back student loans and buy a house at risk, right? You don't have to go all in. You can have an entrepreneurial mindset. So if your path is to go down a certain path, go down that certain path. When that stretch assignment, that opportunity to go into an area of the business naked and afraid, go do it. Go do it and say, I'll take that stretch assignment and figure out how to survive. But you don't have to put your life savings at risk and your parents' life savings. If that's how you're wired, great. I'm so glad you exist in the world. But if you're not, it doesn't mean innovation and entrepreneurship is outside of your reach.
And I would say to the students, and I would venture to say all of us are students all the time, and maybe that's my message. Keep on learning, keep on embracing the unknown. Technology, by its very nature, there's a line I like to use. If you've heard me say it before, I apologize. You're probably tired of it. But right now, the pace of change is the slowest you'll ever see it. It's only going to get faster. And there's only one way to even attempt to keep up with it, and that is to be constantly learning and striving to become what your ambitions and what you think you want to do in order to keep up with that and actually stay ahead of it.
Awesome. All right, thank you all.
Thank you.
All right, we're going to take a quick 5-minute